Welcome to Focus on Health. I'm Joe Gum. We appreciate you joining us. Many women taking hormones for an underactive thyroid often find themselves frustrated. Even though their lab ranges come back normal, they still can't seem to shake the symptoms associated with low thyroid. Joining us today is Dr. Jade Malay to talk with us more about treating an underactive thyroid. Welcome, Dr. Malay.
Thank you, Joe, for having me.
Well, this is a very important topic, and typically you hear about patients after they've been diagnosed with a low thyroid. What happens after that?
Well, what I hear when women come to my office is a lot of frustration, because typically what I see is someone's been diagnosed with underactive thyroid, low thyroid. They're put on a medication. Later their doctor checks their levels. Their levels are within normal limits, so the doctor says, we got it, we have you fixed. But yet the person is still suffering with symptoms and their life is very poor.
Well, what are some of the symptoms that they're suffering from?
The main things that I see is fatigue, inability to lose weight, that is the main one, or gaining weight, brittle hair, brittle nails, and just not feeling well.
So they basically go see their doctor. He puts them maybe on a medication, but he doesn't really tell them how to use the medication or look for something that will help them with the medication, and that's where you come in.
Exactly right, because typically what happens is when people are diagnosed and their blood levels are looked at, they're only looking at one marker, when in fact there are 7 markers that make up this complex gland. So you have to really do a very comprehensive analysis and diagnosis to figure out what's going on. So in my clinic, that's what we do. We dig deep to find out what is the cause of this underactive thyroid. And in fact, the #1 cause for low thyroid isn't even checked with most people.
Well, how come doctors aren't checking for that?
It's just a model of care, and even if they did check it, there isn't a drug to give them. So that's why so many people are suffering. They follow what their doctor's saying, but they're not getting anywhere. So when they come to my office, that's exactly what we do, is we dig deep to find out what the physiological, biochemical, hormonal, and possibly immune problems they may have going on, so we can get this problem taken care of.
Well, like you said a minute ago, it's a model that some doctors use, and unfortunately, basically, when viewers are watching this going, that's exactly what's happened to me. I go to see my doctor, and he basically spends a couple of minutes in the room. I tell him what I have and what I'm going through about the low thyroid. Then he gives the medication, and all of a sudden they're stuck because it's kind of like, hey, I don't know what to do. It's like working out without that trainer. You want that trainer to basically help you along the road. You need a doctor to sort of help you after the medication is prescribed, right? Exactly,
because this problem is so much more complex. There are hormonal issues, there are food sensitivities. We have to really dig deep to find out what is the cause. And for each person, it is different. So with me, yes, I help give them the guidance, the motivation, and handhold them through this whole process.
And it starts with diet, right?
Diet is a very big part of it, and it has to be customized to the individual. As I said earlier, a lot of people are walking around with food allergies and sensitivities that they don't even realize that they have, which is firing up their disease. So diet has to be customized to the person.
Well, let's talk about some of the folks that you've seen, a success story, because we know there are a ton out there.
Sure. The one that pops into my mind is this particular woman who came in. She was experiencing extreme fatigue, couldn't hold down a job. She now holds 2 jobs. She has better sleep patterns, but the amazing thing for this person is in less than 6 months, she dropped 75 pounds without any exercise, and that's just been amazing for her.
That is amazing to lose that type of weight. Now, she feels better, obviously, now, right, because she came to see you.
So much better.
But here's the question a lot of people want to know, is she off the medications?
With her, no. And we work in conjunction with the prescribing doctor to make sure that people stay on the medication that they still need. So with her, she's still on one of her medications, but we were able to get her off quite a few.
And I'm glad you said that, because a lot of people come and see you. You help them sort of get them on a plan of their diet and exercise and how to deal with a low thyroid. Then all of a sudden, some people think, well, I can get off the medication now, but you're not saying that. You may have to stay on it, right?
Exactly. So we work with the prescribing physician to make sure that people are taken care of so that this problem is taken care of properly.
Now, what are you looking for in a patient, real fast?
What I'm looking for is someone who is motivated. That's the main key, because I need someone who hasn't given up hope and who is motivated and cares about their health just as much as I do.
All right, well, thank you so much, Dr. Malay. The offer is out there. We appreciate you joining us. Listen to this. Dr. Malay offers the latest in successful treatment of the thyroid. You can call her today at 972-492-0383 or visit the website at drjademalay.com. The first 25 viewers who call and mention this Focus on Health segment will receive a complimentary consultation. She paid for this segment.